Well, hello and welcome to all of our Gold delegates from around the world. Welcome to our Gold family here at Gold Lactation, and welcome to Dr. Gina Weissman, who is here with us today. I'm Fiona Langsharp, IBCLC and Director of Communications and MC here at Gold Learning. Welcome, Gina, to Gold Lactation. It's so great to have you here.
Thank you so much, Fiona, and hello to everyone.
Well, I'm truly excited about the fact that you're here. It's been a few years that I have seen you at other conferences, and I always start off those conversations. When are we going to see you at Gold? So here you are, Gina. You are somebody. I was just going through your bio with you, and it's saying you have so many things in your bio. So make sure you go to our website, of course, and check that out. But I know that Gina will share a little bit of her story as we get into things here. But look at the topic, Gina. Oh my goodness, you probably get inundated with questions all the time. A case for clipping, a case for waiting, difficult decisions in the clinic. How did you get to this point, Gina, where this is how you felt you needed to pursue your career?
Well, I think, Fiona, that as an IBCLC myself, and I work in a hospital, and I see that there's a lot of pressure on lactation consultants not to miss a baby's tongue tie if it's tongue tied. So this sometimes brings, us to overemphasis and put too many spotlights on that little area of skin under the baby's tongue. And I felt that I myself wonder when should I decide to clip it? When should I wait and observe it again in a week? So I felt I just wanted to share things that I've been, doing within these cases, and I
Right.
hope it will be fruitful for many people because I myself, I don't know many times. I'm not sure. So I just
Right.
wanted to share that.
No, absolutely. And of course, being that this is an area of in the lactation field that, of course, is growing. And as I was reading up on your abstract again today, and really, diving into that, how much do we know? Are we getting this right yet? Because it feels like we're going back and forth, Gina, on many different things. Anterior tongue tie, yes, we've seen it. We've even got research on it, so forth and so on. That posterior tongue tie, though, it's really still tripping us up. I can remember a few years ago where we were definitely doing them all. We were just going to go ahead and clip them. This is when we weren't really doing any body work or any of those types of things, Gina. But what are we doing now? What are the rules? What do we tell our clients?
Well, I think that that we say, okay, anterior tongue tie, there's enough research to, support deciding to cut that and emancipate the tongue. And I think that when we get into posterior tongue tie, then there is no hard evidence that I can tell you that it's really random. There's no randomized controlled trials that are really good that have looked at kids. So our evidence of clinicians is, going to have to satisfy us for now. I think we're being more careful. We are looking at other areas, like you said, body work. So I think that's something that I've learned more about the past 5 years. I myself don't do it, but I will refer and then, evaluate the tongue again.
Sure.
It's like an emerging, we're just at the beginning, I think, of understanding what's really going on there.
Yeah, it feels like sometimes it feels like we're getting bombarded, or every time I walk in to see a mom and baby, it's a tongue tie, it's a tongue tie. How could it be? How is this coming up over and over again? Whereas years ago it seemed, we were seeing them once in a while. But maybe the demand has changed, Gina. Maybe that's what we're seeing is that the consumer, the parents, have started to say, I want to breastfeed, and so therefore I want someone to check this, review it, and see if there is a problem. Do you think that's part of what we're seeing too with the increase that we seem to be seeing as clinicians?
Yes, there is an increased awareness in the public and they're demanding it, and that's what I think is causing a lot of pressure. It's interesting, like last Monday I had a patient, She has various issues and problems, and it's like already 6 weeks after birth. And she said,
Right.
"Well, why am I here?" I asked her, "Why did you come?" And she said, "Well, a friend of mine told me that if things are not working out yet after 6 weeks, then have you considered tongue tie? Maybe you should get that checked." And I told one of my interns, like, how did we get into that position where instead of hearing from her friend, well, if it's not working out, go see an LC, the first thing that people are offering this poor woman is, have you checked tongue tie?
Right.
Statistically, that can't be. It's not supposed to be that way. And I asked her, do you have a lactation consultant who's been,
Mhm.
helping you for the past 6 weeks? No, I've been like trying to figure it out myself. So that's a big mistake.
Yeah. Yeah, you're absolutely right. And too, I'm having sort of this flashback moment in my mind hearing those conversations that they're actually skipping over all the other things that actually we could have looked at as a lactation consultant and into those areas. So it's very interesting. We've got some work to do, Gina. We've got some
Yeah.
counseling to do and all those types of things. Well, I know that we're going to be learning lots from you about your experience in your clinic, as it says, on your PowerPoint slide there. So I'm very excited to hear more about your topic, and I will let the audience. We'll just take a pause for the moment because I want the audience to know a little bit more about the conference. It starts on April 1st. Okay, so this is your first day. You can join us. It's a free and open access. You can see on the screen there, Gold Lactation is at our goldlactation.com website, so you can come and sign up there. Gina, however, is going to be live. So if you want to come and meet Gina and be part of our audience on that day, she is going to be with us for most of you on Tuesday the 23rd. Now, I say most of you because, of course, some of you are different time zones, so you need to go to the website, check out the conference schedule. But I will be with Gina on Tuesday, the 23rd, and she will be with me. But she, of course, will be in the evening. I will be in the morning as Gina resides in Israel. So tell me a little bit about what it's like in Israel, Gina. Just switching gears here. I want to know a little bit about what your life might look like on a daily basis and how things are. I know that you're mentoring students. You're also helping with students with their IBCLC exam. So tell me what your life looks like on a day-to-day basis there.
Well, I divide my time between working in the hospital. I work in a maternity hospital, and I work there twice a week. Our week
Right.
starts on Sunday, which is our Sabbath day is Saturday. So we start working on Sunday, and so when I come to the hospital on Sunday, I always have to like see what happened over the weekend. There we don't always have an LC working on the weekend on Saturday.
Mhm.
And so I'm usually swamped with women who have engorgement and have sores and are, maybe want to go home. So
Right.
it's always a challenging day. And then Monday and Thursday I work in my private clinic and I
Right.
have students and interns working with me. So I have like 3 rooms and I try to like I work on all 3 rooms sometimes together. Like in one room I'd have a 2 week old baby and then the other room a 2 day-old baby. And my interns help me like take care of everybody. By the end of the day we sit and we kind of make a list of what did we see today, did we do good with everybody. We try to reflect on things and think, oh, maybe we missed something, and we have a really good group to talk about what we maybe should do now in the follow-up and who should call who, and try to make sure that we didn't miss anything. And
That's awesome.
Friday, I teach in my course. I have a 200-hour management course. It's a basic course. It started out like the 90 hours for
Right.
IBLC, but
Yeah.
it grew. And then every year I said, well, I'm going to put in a day about pacifiers, and then I'm going to put a day about preemies. And then suddenly, from 90 hours, it got to be 200 hours.
Oh my goodness.
So
That's
that's
huge.
on Friday. And so Tuesday, I'm free for conferences. Like today's Tuesday going to be like that day that I'm going to talk.
That's perfect. That's perfect. It worked out really well for us. So clearly very busy. And as you mentioned that you're doing lots of mentoring, which is really the crux. Laura Wilson and I were talking yesterday. I interviewed her for her presentation coming up here too. And we were talking about mentoring the people behind us and how significant and important it is that we're not just learning online, but we are spending time in clinic together. We are with, clients and patients and so forth and so on, and they can see the practice that we have, so that they can grow behind us. It's such an important thing. So kudos to you. It seems like that's really a lot of what you're doing, including I saw you're working not only with lactation students, but also with medical professionals as well. And I'm guessing that they come and be part of your clinic and your teachings that you have on Fridays.
Yes, yes, I think I see it as a great privilege.
Mhm.
And I really learn a lot from each mother and baby, but I also learn a lot from my students and from my interns. And I really feel that I need them to be a better LC. I mean, I just want to say, like, I really feel I'm on my best behavior when somebody's looking over my shoulder.
Yes.
And and then I kind of like really have to think, well, am I saying the exact thing? Am I sure? Maybe there's different options here. Maybe I should, ask what the other person in the room thinks. And I really try to include them. And I also tell the mother, listen, I always work as part of a staff because I think that there's always, multiple options and we can think together with you, mother, what's best for you. Like, how would you like to proceed? How would you solve this? I use a lot of talking and communication skills as I go along because I really feel that, like, like I learned myself from Linda Smith and Tina Smiley and all my mentors, that there's always another way, and, we have to find the best way for each mother.
There's always another way. I love that, Gina. You find a way around it, looking always for the solutions and not the problems, right? So
Yeah.
that's fabulous. That's fabulous. So tell me, now that we know kind of, I mean, I don't know if you have time for anything else, but what's what's coming up for you this year, Gina? Have you got any plans with
Oh, you're so
family?
sweet to ask.
Plans? Are you planning to come over to North America where we are? Are you too busy? Where are we going to see you next?
Well, it's really interesting because I was thinking that just not long ago, like a few hours ago, that I have like many plans to travel over the next year because I have like almost every month I have a different conference, but none of them are in the US because also this year even ABM is going to be in Manchester.
Right?
So I don't know if I'm coming to the ILCA conference yet. And so it's just interesting that I was just thinking and reflecting on
Yeah.
that I don't know if I'll see New York this year, but I'm
Yeah.
going to be in Greece at the annual Lactation conference for IBCLCs. It's next week in Greece.
Oh, wonderful.
And I'm lecturing there on 2 days, on the 7th and the 8th. And then later during the year, Croatia, and I'm going to be at the Dutch conference at the beginning of April, also for the IBCLCs, their annual conference. So I'm going to be busy with different things. Oh,
Oh,
sorry.
definitely.
Next week is the Dutch conference.
Oh, next
Good that
week.
we're talking about it, so I get my airport. Good.
Yeah.
Next week I'm going to be in Amsterdam, in Utrecht,
Oh.
and then at the beginning of April it's Greece.
Oh, that's wonderful. That's wonderful. So we might not be able to get to, to see you in North America this year, but anyone that's listening in Europe, uh, Greece, Croatia, and Amsterdam, Manchester, be there because that's where Gina Weissman is going to be, and she is certainly a person that you would love to catch up with. Always the time that we spend together, Gina, has always been very fruitful for me. So thank you for always being so open and caring and sharing with, your role in the lactation field as a dentist and as a nurse and as an IBCLC. It's just wonderful, wonderful to have you. So thank you for being part of our big community and part of our Gold family here at Gold Lactation.
My pleasure, really, Fiona. Thank you so much for giving me the opportunity to come.
That's awesome. Well, thank you again to Dr. Gina Weissman for being with us here today. It is time for us to wrap things up. We'll look forward to hearing from you as well. Don't forget, so Gina will be part of our Gold Lactation Conference this year. She's going to be live on Tuesday the 23rd. Unless you're, in a slightly different time zone, it might be the following day. So do check the website. You can check out also the forums as well. If you're part of the Gold Lactation Conference, you have an opportunity to connect with Gina online as well as during her live event as well. So thank you again to everyone for listening in today. I'm Fiona Langsharp. We'll talk to you all again soon. Bye bye for now.